In this episode, we'll be talking about a fertility saboteur that is impacting so many couples on their fertility journey and they don't even realize it. Plus, steps you can take so you can become more empowered and confident on your fertility journey, and some actionable steps for you to take away so you can start working and improving your fertility, your odds of having a healthy conception and pregnancy as well. So let's dive in. Welcome to the Finally Get Pregnant Naturally podcast, the podcast helping women identify the real reasons you haven't conceived or stayed pregnant so you and your partner can finally grow the family of your dreams. I'm your host, Dr. Katie Wood. Let's dive in, shall we? Hello and welcome to our weekly Get Pregnant Now Quickie. In this episode, I'm going to be following on the coattails of Tuesday's episode with Hannah Davis, where we discussed functional testing and how that can help you on your fertility journey. So I want to kind of dive in a little bit deeper, share some of my experiences with my clients and how functional testing has helped them get pregnant. Okay. So, the fertility saboteur of this episode is basically taking the surface level labs that your OB, your primary care doctor, or even your fertility specialist are having you do. And you're either being told things look normal, or maybe you're being diagnosed with something like PCOS, but then they're just only giving you fertility treatment as options. It could be medicated cycles, it could be IUI, or it could even be IVF, or in some extreme cases, sperm or egg donors. And this is not always necessary in each case. Okay. I think the percentage where we would actually have to go to these extremes is actually a lot lower. It's just conventional doctors are not digging deep enough to treat the root of the issue of why you're not conceiving or why you're not carrying a pregnancy. So I'm going to share some insights in terms of what you can do, what to look out for, and how to make sure that this isn't happening to you on your fertility journey. I hear this all the time in my DMs, right? I'm having so many conversations in my DMs every single day, and it's so prevalent and so common where people are having labs or tests through their doctors and they still don't really have any answers. And even if they do maybe find out that male factor is an issue, maybe it's PCOS or endo or low AMH, something like that, there's really not anything being done about it. We have the surface level understanding of what could be going on, or maybe we don't. Maybe you were diagnosed with unexplained infertility and you have no idea, right? Because everything came back as quote unquote normal, which, reminder, normal does not equal optimal, especially for natural fertility. And we need to take it a few steps deeper to see what is going on. And I have two client examples I want to share with you. One client, she has worked with at least three other practitioners to help her. And this is even through functional medicine, actually. She's worked with a couple of other functional medicine practitioners, and she still hasn't gotten the results. So that's why, listen, I am so happy if anyone is willing to go down the more holistic functional medicine route. But sometimes, functional practitioners, if they're not focused on fertility, they may be able to help you, but it may be only so much. Where someone who has been certified and trained in functional medicine specific for fertility, like that is their expertise through and through. Those are the types of practitioners like myself, like my colleagues, that I would highly recommend working with on your fertility journey, but it cannot hurt to start with functional medicine, period. So, anyways, one client had worked with a few other practitioners and did some functional testing, but they didn't have the foundational understanding of fertility when interpreting some of these functional tests. So, they did recommend, protocols and things like that, but unfortunately, it did not give them the end result. Plus, the protocols and testing that I follow with my clients has been tested, tried, and true, and they have been proven, right, with an 85% success rate. So I know that Hannah in Tuesday's episode, she discussed some testing that she likes to do with her clients, being the Dutch test, sometimes a GI map, and the HTMA. And for my program, I thought I could discuss some of the testing that I do as well. So Dutch is at the top of the list. We definitely do Dutch on our female clients for sure, because it gives such a deep insight and understanding of what is going on in the hormones. If you want to hear a little bit more about the Dutch test, go back and listen to Tuesday's episode with Hannah Davis on functional testing for fertility. But Dutch test is definitely one. But then we also do, it's basically like a micronutrient assay and an antioxidant assay and a food intolerance test. So, this one client who's worked with a few other providers, she did have a Dutch test, which I thought was great. But we ran this micronutrient assay and also the food intolerance, and she came back as one of the most like nutrient deficient clients that I have seen to date. And also, she had a pretty long list of food intolerances. And in her previous work with other providers, no one really explored her gut health to the depths that we would want to explore to see what could be going on. So for her, I'm recommending based on what we're seeing, because in my mind, I'm thinking, okay, we have a lot of food intolerances that can cause something that is called leaky gut. And then also, if we're not having the right amount of stomach acid and enzymes, then you aren't what you eat. You are what you absorb. And since she was so deficient in a lot of nutrients, despite having a healthy diet and taking supplements, quality supplements, it's making me wonder, is something going on in her gut where she's not able to absorb what she's taking in? So we're actually going to do a GI map. We're going to do a little bit more exploring to see what could be going on, okay? And these are tests that your regular doctor, your OB, your fertility specialist would never do for you, and they also don't know how to interpret them. It's not part of their practice, it's not part of their protocol, it's nothing against them, it's just not something that they do at their practice. So these aren't tests that you can go to your regular conventional doctor and ask for because they won't do it for you. And another client that I have is a woman who has experienced 5 miscarriages. And her doctor they did some sort of vaginal swab for her. I don't know exactly what it was. And they just threw a Z-Pack at her to treat ureaplasma, but they didn't even know if she had ureaplasma. And because having a vaginal microbiome dysbiosis can cause fertility issues and also increase your chance of miscarriage depending on what's going on. So, out of all the other functional testing that we did, including ones I just shared with you, we also do a vaginal microbiome. And it's very comprehensive, and it came back, and she had a lot going on. She had ureaplasma, she had Gardnerella, and also no healthy Lactobacillus crispatus available or any lactobacillus at all. We are currently actually waiting for her recheck results to come back. But this is just an example of where you're being left behind and not being truly taken care of in the conventional space because no one was even really looking into why are you experiencing so many miscarriages, right? I wish that no one had to experience a miscarriage, but five, there's something going on and we need to dig deeper to see what that is. And unfortunately, that might not always be covered at the regular doctor's office. So outside of the other functional testing that we're doing, the vaginal microbiome, I think, is going to be a game changer for her because of what we found in those results. And I actually have one more client example that I want to share with you, and I've shared this before, is a client who had basically picture perfect cycle day 3 hormones in her serum, so a blood draw. But then when we did the Dutch test, it was a completely different understanding of what's going on. And in fact, yes, it showed her hormones were looking optimal around cycle day 3, but her estrogen was actually not in an optimal place at all. And because of doing the Dutch test, we were able to make a few very simple shifts and changes. And within that next cycle, she was seeing abundant, fertile cervical mucus. She had a beautiful estrogen peak. And then her PDG using, I believe she uses a Nido, was just like off the chart. So she had a beautiful ovulation because she was supporting her estrogen, which is imperative in the follicular phase to support proper and optimal egg development. And that is why she had such a nice, robust progesterone in her luteal phase. And she wasn't currently trying because we had just finished a detox. Otherwise, who knows what would have happened that cycle if they were trying. But here's a recap. One is not taking your labs that you get from your regular doctor at face value and thinking that things are either a-okay and perfectly normal or not digging deeper into why maybe you have PCOS, endometriosis, male factor infertility, right? The list goes on, especially not digging deeper if you've been diagnosed with unexplained infertility, right? And how functional testing can give you like real-time insights and understanding of what is truly going on. And a lot of times these things are being missed. And it's really unfortunate because once you correct these, and it doesn't take long necessarily for each case, it might be a shorter period of time in terms of correcting the issue. Some things might take a little bit longer to correct the issue and take some time for healing. But when you have that insight, then you can find answers. And these answers, these protocols are specific to you instead of trying to fit you in this box where every other woman is being fit into on their fertility journey and it might work for her, but it might not work for you. This is where tailored solutions come in. So what you can do is I'm more than happy to talk to you about your fertility journey, take a peek at your labs, share some insights. There's more that we can look at than just your labs, your cycle health, your cycle charts, symptoms that you could be experiencing. There's so many other things that can paint the full picture. So please feel free to reach out to me on Instagram. I'd be more than happy to chat with you and or find a fertility practitioner who is able to order and interpret functional testing for you. And ideally, they have protocols that have been proven to help couples conceive, no matter how long they've been trying, no matter what they've been told by their doctor. Many times, you can, in fact, absolutely get pregnant naturally and or with the help of fertility treatments if that is necessary. So some action steps for you are to take a look at your labs. If your doctor or doctor's office just told you over the phone that things look normal, no. Those labs are your property. You paid for those, either out of pocket or through your insurance. So I would highly recommend calling your doctor, getting those lab results, looking them over yourself. I'm sure it will look like a completely different language to you. So if that's the case, find me on Instagram at the_wellness_pharmacist. Let's chat. You can send them over to me. I'll take a peek, share some insights. We can even book a free call and go over everything. So let this just be your reminder that your doctor doesn't know everything, and that's okay. Nobody knows everything. I admittedly do not know everything. If there is something that comes up for one of my clients, I'm doing the research. I'm trying to find those answers to figure that out for them. They are trained in what they're trained in, and then also they have to abide by the rules and regulations and protocols at their practice that they work at. Whereas there's a little bit more flexibility and freedom when you're working with a holistic and functional practitioner, right? There's more autonomy there. So yeah, get your lab results, share them with a trusted fertility practitioner, health professional who can help interpret them and explain them to you, because there are normal labs, but then there are optimal labs, and optimal for ideally natural conception. So I just want to remind you that there are more answers for you waiting to be discovered and waiting for you to find them. I feel so strongly in my bones that our struggles in life, but in this particular case, fertility struggles, are here for us for a reason, so we can heal ourselves physically, mentally, spiritually, emotionally, energetically, to then step into the parents that our babies are wanting us to be. I know for me personally, I healed so much on my fertility journey, and that was just like the catalyst for my healing. It has just been going and expanding, and I know that I've had so many clients who are open to this healing just shift so much in so many beautiful ways and heal themselves and accept that yes, this journey feels really hard and really difficult right now. There's no doubting that or questioning that. It is hard and it sucks sometimes. But when you can accept the end result of, yes, this hurts right now, but my intuition is telling me that this is for a greater purpose. This is for my greater evolution and healing. And this is all available to you. So thank you so much for listening. I can't wait to see you on next Tuesday's episode, and I'll see you there. Are you ready to finally discover why you haven't been able to get or stay pregnant? The Ultimate Fertility Blueprint is a quick, insightful quiz designed to reveal your overall capacity to conceive and help you discover potential root causes and areas to address to improve your fertility so you can finally get and stay pregnant. In just a few minutes, you'll gain valuable insights and have an opportunity to book a free fertility strategy session to go over your results and fertility journey to finally get answers so you can optimize your fertility. You'll find the link in the show notes, and be sure to mark your calendar so you never miss out on our fertility-focused episodes released every Tuesday and Thursday. As a quick reminder and disclaimer, this podcast is for educational purposes only and is not a substitute for medical advice. Always consult your doctor or healthcare provider before starting any new supplement or protocol, especially if you're actively trying to conceive or undergoing treatment.